Welcome to the webinar. We will start in a minute or so. We're just going to give people some time to get settled. Good afternoon and welcome to Challenging Community Health Choices Personal Assistance Services Denial, a webinar for direct care workers. This webinar is being recorded. My name is Amy Lowenstein and I am joined today by Pam Silver. We are both attorneys at the Pennsylvania Health Law Project. I'd like to quickly go over a few items so you can participate in today's events. You will have the opportunity to submit questions to the presenters by typing them in the Q&A pane of the control panel, which should be at the bottom center of your screen. You may submit your questions at any time during the webinar. We may answer some of them through the Q&A pane, and we will answer others at the end of the webinar. The slides used in this webinar will be emailed out along with a survey after the webinar is complete. The recording of the webinar will also be made available. If you have technical difficulties at any point, please hang up and dial or log back into the webinar. If the problem persists, you can email event@phlp.org. That's event@phlp.org. As you may be aware, thousands of Pennsylvanians with disabilities and older adults enrolled in Community Health Choices have had cuts to or denials of their personal assistance services hours. These participants have many rights when they are denied a service, including the right to appeal. Unfortunately, the appeals process itself is very confusing, and to make matters worse, participants have encountered numerous problems exercising their rights. This is because of breakdowns in the way each of the CHC plans have handled appeals. We hope this training will help CHC participants understand and navigate the appeals process. And above all, we hope you will know where to turn for help if the participant or you encounter problems. So I want to tell you a little bit about the Pennsylvania Health Law Project before we really get started. We are a statewide nonprofit legal organization, and we work on ensuring access to public health coverage and services. Our primary focus is been on Medicaid, and we have had a particular focus on Community Health Choices since it began over 3 years ago. We help Pennsylvanians in a number of ways. We have a helpline that's free for our clients, and through this helpline, we provide advice as well as legal representation. We serve clients in all Pennsylvania counties, and we do not have income limits to qualify for our services. We also provide technical assistance to providers and advocates through our helpline and through email. We do community education and trainings, and we've developed self-help materials as well. There are links to some of the self-help materials at the end of this webinar, including a number related to Community Health Choices. We also have a monthly email newsletter where we update people on policy developments at the federal and state level and provide action alerts about developments in the different programs, including in Community Health Choices. When you get the slides, there will be a link you can click on to sign up for the newsletter. And we also do a lot of policy advocacy at the state and federal levels to really increase access to quality healthcare coverage and services. Over the last couple years, Community Health Choices has been a big part of our policy advocacy, and we have done a lot of work, particularly around appeals, both in trying to make sure the appeals process is working for participants and alerting the state to problems when we see issues arise where participants are having trouble exercising their appeal rights, which unfortunately happens far too often. So here's what's going to happen today. We're going to start out with an overview of the appeals process and the procedures. And then we're going to get a little into the different levels of appeals, starting with the grievance, which is the first level. And it's also considered an internal appeal to the plan. Then Pam is going to talk about grievance preparation. So what can be done to really prepare for a grievance on personal assistance service denials. And then we're going to provide information about other appeal levels, because there are actually 3 different types of appeals in Community Health Choices, although they don't necessarily happen sequentially. So it's very important to pay attention to how the different levels work. Finally, at the end, we will answer as many questions as we can. And if there are additional questions we cannot get to, we will endeavor to send out those answers by email. So I want to start with just a really quick overview of some of the terminology you'll see. This is sort of like your glossary to acronyms. And the first one is actually APP. So you're going to see this throughout the presentation. APP stands for Aid Paid Pending. What that is it's a right, it's a due process right to continue getting a Medicaid service while an appeal is ongoing. So this is a critical right, and it exists at every stage of the appeal. And for personal assistance services, it means that if somebody gets their services cut and they appeal within a certain time frame, they get to keep the services at that level while they appeal to try to get that service permanent again. So it's a strange term, APP, or Aid Paid Pending, but it really means keeping the services in place while you're trying to challenge a reduction. CHC, as you probably all know, stands for Community Health Choices. This is the way that most adults with disabilities and seniors get home and community-based services, like personal assistance services, like private duty nursing, or home modifications. Now, home and community-based services are those services that I just listed. There are a number of them available in Community Health Choices. You'll also hear people call them different things. So you might hear people say community-based long-term services and supports, or Medicaid waiver services, or home and community-based services. Those are all the same thing. They are the services that people get to help them live in the community and avoid nursing facility placement. You'll briefly see the acronym LTSS, which stands for Long-Term Services and Supports. That actually encompasses the community supports that keep people out of nursing facilities, but it also includes nursing facility services. It's a broader term. And finally, if you're on this webinar, I think you probably know this term, but PAS stands for Personal Assistance Services. That's the personal care that is provided by so many of you, or that many of you receive, to help people be able to perform daily living activities, engage in community life, and for some people to be able to live safely in their homes. So I'm going to start out with an overview of the whole appeals process, and then we'll get a little bit into the different levels. So before you have an appeal, you have a denial. So what is a denial? Well, in Medicaid and in CHC, it's the CHC plan's decision to deny or reduce or terminate or even change a medical service or item like a dental service, a medication, a request for a wheelchair, or to change or deny or reduce a home and community-based service such as personal assistance services. Now, for waiver services, if they're going to change somebody's waiver services, like their personal assistance services, there really is supposed to be a comprehensive needs assessment before that happens to make sure that the person's needs are all being met, and that if there is any change, that's not going to mean that there are unmet needs. So that is a very lengthy assessment. It usually takes several hours, and it's supposed to be conducted in people's homes. During COVID, people are allowed to have that done by telephone, but it's really up to the participant. If they want that assessment in their home, it's supposed to take place in their home. And out of that assessment, the plan will make determinations about the services needed. Okay, so if there is a denial, there are certain rights that attach. A CHC plan can't just deny a service and then stop providing it. There has to be notice, and that notice has to be in writing. It cannot just be over the phone. So the right is that there is a written notice of any denial. That includes a request for an increase. So if I'm getting 20 hours of personal assistance services and I request 40 hours per week and my plan decides to deny it, they still need to send me a notice telling me that they've done that, that they've made that denial. Otherwise, I don't know what's happened. And I think, maybe they didn't get a chance to decide. But it's also critical that it be sent in advance if they're going to reduce, terminate, or change a service that somebody's already getting. And the rule there is that they have to mail the notice at least 10 days before a reduction, termination, or change in services. We'll talk a little bit more about timing several times during this training. So it's important that participants, and if you're working with participants who want you to help them with their mail, if you're a worker, you check the mail regularly. When I say regularly, I really do mean every day. Sometimes I get so much junk mail, I just don't feel like checking my mail some days. But if you're receiving an important government benefit, like personal assistance services, it's really critical to check the mail, because if you miss a deadline because you didn't check the mail, it can affect somebody's ability to keep services in place. To make sure people get their mail, and there's no way to totally ensure it, make sure that participants you work with and report changes in their address. Now, because Community Health Choices is a Medicaid program, the primary place they should be reporting that change is the county assistance office. That's the one who makes the Medicaid determinations, because that file from the county assistance office is sent to the CHC plans, and it's what tells the CHC plan what address to use. So it's important to tell the CHC plan as well. But we've had instances where people have told the CHC plan of a move, forgot to tell the county assistance office, and then the county assistance office's old information about an address overwrites the new information that the plan has, and the plan winds up with the wrong information again. So it's really critical. The other thing is we put Social Security Administration up here as well. For people who are on SSI, that's Supplemental Security Income, they need to tell the Social Security Administration about move, because the Social Security Administration tells the county assistance office what the correct address is, who in turn tells the plan. So it's really critical to report those address changes and report them to really, the default should be everybody. Now, checking the mail also means opening and reading the mail. I know I have a pile of unread mail, but at least make sure you're looking for anything from the CHC plan and read it immediately. And finally, keep all notices and letters and envelopes that affect the person's services. So you'll want to hold on to them. The reason to hold on to envelopes is, as I said, there needs to be a mailing 10 days before a reduction. And if that was mailed later, you want to be able to show, well, this wasn't actually mailed the same date as the letter. Now, notices do need to be accessible for people with vision impairments, as well as people with limited English proficiency. So if somebody is having trouble if somebody needs notices in another language like Spanish or Arabic or Russian, they should contact the county assistance office and the CHC plan to put their language preference in. Like address changes, the language that notices come from are based on what information the county assistance office has. So that's also critical. Now, one thing about notices, these notices are supposed to explain in detail every reason for a denial. So if my personal assistance services are being cut, I should be able to read that notice and understand why. Unfortunately, some plans do this better than others. Some are more detailed than others. And there's at least one plan that doesn't provide any reason at all. And it's something we're working on. But for that reason, and Pam's going to talk about this later on, it's important to request the documents the plan used to make its decision. So we'll talk about that later. All right, so there are 3 basic types of personal assistance service denials. Somebody can file an appeal when a service is denied completely. This is, let's say somebody is new to the waiver and they are assessed and they ask for personal assistance services. They don't know how much, and they get a response saying, you're not approved for any, but we'll give you a personal emergency response button. That is a complete denial. The other thing you'll see is a denial that says approved other than as requested. That is also a denial. I know it says approved other than as requested, but really it is nothing more than a denial. And you'll usually see this actually when personal assistance services are reduced or when someone is given fewer hours than they asked for. So for example, if I were getting 70 hours of PAS and the plan is reducing it to 56, the notice might say, your request to continue 70 hours of PAS is approved other than as requested. 56 hours are approved. The rest of the hours are denied. Or if it's an increased request, it might read something like, your request for an increase to 30 hours of PAS is approved other than as requested. We are approving 20 hours. The additional 10 hours are denied. The third type you may see, but this is not as frequent with personal assistance services, is denied as requested, but the following service or item is approved. This is really a substitution of a service. Now, where we have seen this is where people are getting private duty nursing hours in their home. So for example, you might see a situation where someone was getting 50 hours a week of private duty nursing, and the plan decides they're not going to provide nursing anymore, and it will say, your request to continue 50 hours of private duty nursing is denied as requested, but the following service or item is approved. We are approving 50 hours of personal assistance services. So they're substituting the nursing for the personal assistance services. So really, what is an appeal? So you get this denial, what do? You want to challenge it. And that's what an appeal really is. It's a process to actually challenge the CHC plan decision to reduce, deny, or limit any service or item. And this is a very broad right. Now, there's supposed to be a notice every time this happens, but you do not have to wait for a denial notice to appeal. So if somebody tells you your personal assistance services hours are going to be cut, and often the service coordinators will give you the heads up, they really should be, you have the right to request an appeal at that moment. by contacting the plan. So you don't have to wait. And, it's not necessarily a good idea to wait with all the problems with the mail right now. We have a lot of instances where people just aren't getting notices or they're coming very late. Okay, so now I want to talk a little bit more about appealing and keeping benefits in place, because this is really probably one of the most important due process rights. I can say due process because, yes, this is a constitutional right. It's one of the most important rights, and it's one that we see people struggle with because the process is so confusing and the notices are so long. So when there's a service that is reduced or eliminated that a person's already getting, like personal assistance services, there's a right to continue that service while appealing the decision, while making a challenge. This is at every stage of the appeal process. So this, again, as I said earlier, is the right to aid paid pending. You have to, or the participant really has to, appeal within 10 days of the mail date on the denial notice, or prior to the decision effective date, whichever is later. So the notices will all have a date. That date should match the date on the envelope that was sent, if that envelope has a date. We have seen one plan sometimes use a type of mail that doesn't have any date, which is really frustrating because you can't necessarily say when the envelope was put in the mail. But really look at the date on the letter, and if you're within the 10-day period, I'm going to talk a little bit more about what that is now, but if you're within that 10-day period, help the participant put that appeal in, right? And if you're in doubt, put it in quickly anyway, all right? This, as I said, applies to all levels of appeal. And because of COVID and all of the problems with the mail being late, and with some of the issues with just the Postal Service, cutting back on the number of employees, and there were a lot of issues getting mail. So all of the CHC plans agreed to extend the deadline for continuing benefits to 15 days. So this means that when somebody gets a denial notice, at least during COVID, that notice should tell them that they have 15 days. Actually, what it'll do is it'll give them on the exact date they have by which to appeal. And I'm going to give, here's some of the way that will look. So I've given two examples of language. The first is an example where the date is actually given. Now, this is an older notice, but it will say something like the current 160 hours of personal assistance services you have been getting will end on, and it'll give the date. Unless you file a complaint or grievance by, and here it gives the exact date. Look for that language, file within that date. If you miss it, file anyway, file the appeal anyway. The participant should go ahead and do that, because if you can show that it was mailed late or you got it late, some of the plans are flexible about giving aid paid pending. Now, the second example I'm giving is actually what someone will get after, when they get their appeal decision. So this language is also about continuing benefits. This is the older language that says 10 days, but it just says 10 days from the date on this notice. So you have to do the counting yourself. Now at this point, it should say 15 days. We know that at least two of the plans are definitely providing 15 days for subsequent appeals, but just look at the notice and confirm what it says. And if you missed it, appeal quickly anyway, because there are still ways we might be able to help you argue that you have a right to continue getting the benefits. Okay, so I've talked a little bit about how there are appeals and there are multiple levels of appeals, and this is really a framework for appeals. It starts with a denial notice, and then there's the right to appeal that to what's called a grievance. A grievance, I'm going to go into detail about, is an internal plan appeal. That is the first step. You may not bypass that step and go to a fair hearing or get an independent external review. The participant has to request the grievance first. It's called exhaustion. They have to exhaust that process. And if they don't, it can actually cause problems with them being able to file an appeal at all. After the internal plan appeal, a decision will be issued. And if the participant's not happy with that decision, they can appeal to 2 more levels, but those levels are really on the same level. They can appeal to what's called an external review, which is an independent medical review, or to a state fair hearing. And if there's a reduction in services, they should do that at the same time. Do not wait. We're going to mention this more a little later in the presentation. Now, I put up here the 10 days for aid paid pending, but as I noted before, it should be 15, at least during the COVID emergency. Okay, so now I'm going to talk a little bit about what a grievance is, and this is the first level of appeal. It's the internal CHC plan appeal. And it's really a request to the CHC plan that it change its decision to deny, reduce, terminate, or change a service or item. So this is not an independent review. This is really a request that the plan change its mind. And you can have varying success here. So do not treat this as something that you shouldn't bother with or should just treat as like, oh, I'll file that. And then I'll just file the next levels and take those more seriously. Plans really do take these grievances seriously, and we have seen reversals. It's not, I don't know the rate of reversals. We've asked for information on that, but it's, there are some states where if you file an internal plan appeal, there's no point really going to it. There is here in Pennsylvania. So one thing that is critical is understanding who may request a grievance. So obviously the CHC participant can do it. So can a power of attorney or a legal guardian. This is somebody who's appointed by the court. The others who can do it, depending on the situation, is a healthcare power of attorney or agent or a healthcare representative. These last two are really, the healthcare power of attorney is a document that someone signs, and it really only goes into effect when the person who wants to appeal, the participant, is not able to make healthcare decisions. The same is true of a healthcare representative, but there's no paper. So, with a healthcare power of attorney, I designate somebody to be my healthcare agent if I lose my ability to make those kinds of decisions, cognitively lose my ability. But a lot of people haven't executed documents like that. So in those cases, a healthcare representative can be appointed if a doctor says the person can't make healthcare decisions. And who is the healthcare representative depends on family relationships. So there's an order of preference based on the relationship to the person. But the other thing is, anybody that the participant names in writing, including a service provider, can also request a grievance. But to do that, it has to be designated in writing. So we have seen situations where somebody other than these people requests a grievance and plans haven't processed it. And, it is a complicated situation, but it's troubling because we've seen it where they just sort of don't process the request for an appeal at all and don't tell anybody they're not going to process it. They don't tell the participant who may have said to their brother, hey, can you call? I'm having trouble with the phone. Can you call and request this grievance? And then never find out that it wasn't even processed. That is extremely problematic. So we want to hear about those situations, but there are some ways to prevent that from happening, which we'll discuss. But that is inappropriate to sort of not honor somebody's appeal or check to see if they wanted to appeal if the wrong person made the appeal. Okay, so quickly, I sort of went over this briefly, but just to emphasize it here, there is certain timing for a grievance request. So if it's a reduction in services, you want to try to keep the services in place with the aid paid pending. And so it has to be done prior to the effective date of the decision, or within 10 days, 15 during COVID, of the mail date. But otherwise, a person has more time, and they have up to 60 days of the notice to request an appeal. And when would you want to do this? Well, first of all, you would want to wait. You wouldn't want to wait if you're having a reduction, but if you totally blew the deadline, and just didn't get around to appealing, you still want to appeal. So you have 60 days. The other time people might wait is if the request was for an increase in services or a new service. Now, you don't have to wait, but some people wait a little bit because they want to make sure they have all their evidence in order. We generally recommend that people appeal right away because there is a little time before the grievance review is held. And usually that's enough time to gather evidence. So assuming you have the right person to request a grievance, how do you actually request it? The information on how to request a grievance is on the denial notice, but let's say you don't have the denial notice. You can get it on the plan's website or in the participant handbook. And there are 3 ways to request a grievance. One is by phone. This is the most common way to do it, but it's really critical that when you do this or you help someone do this, that you write down the date and time of the call, the name of the person at the CHC plan the person speaks to, and ask for a reference number for the call. And write down and save this information, because if someone turns around and says we have no record of your appeal, you'll be able to produce that information. Now, if a participant is having trouble making the call on their own and you want to assist them, make sure the participant is there on the phone to say, yes, I want to make this appeal. All right, so that way it's acknowledged that they're here. Yes, I want help making this appeal, and I'm making an appeal of the decision. And then, if you can, send a letter confirming the grievance request. But often, because of such short deadlines, people want to do this by phone, and I totally get that. You can also do it by fax, which is handy because you get a fax confirmation, so you can prove that it was sent. And you can also do it by mail using the form that is enclosed with the denial. We strongly urge people to send this certified. It does cost a little extra money, which I know is not possible for some people, but if you can, send it certified because you can confirm that it was received and sent. Okay. So what do you include with a grievance request? Well, so here on this slide, I have a copy of the form that is included with the denial notice. It's sort of towards the middle to the end of the denial notice. And it asks all the questions that are needed to be answered when you file a grievance. But if you're calling, you want to make sure, or let's say you've lost the form or the form wasn't included, you want to just do the following. You want to say, or have the participant say, I am filing a grievance. And then you provide the decision that's being appealed and the date. Now they may say, why are you filing? You can give details, but you don't have to really say anything. We sometimes just write, the services are medically necessary, or I disagree with the decision. It doesn't, this statement is not going to be what the grievance decision is made on, because your participant is going to want to have an opportunity to actually present their case, and they can still send additional documents. Then we recommend that people participate in what's called a grievance review meeting, or some plans call it a grievance hearing. it's critical to say that the participants say, I want to participate, and then say how, by conference call, video, or in person. If you don't ask to participate in person, they will hold the grievance without the person. This happens fairly frequently, so it really is important to emphasize that. And then also request all the information that the plan used to make its decision, which Pam is going to talk a little bit more about, like what that would look like. And then if someone's representing you, you will give their name and contact information. And of course, if this is in writing, the CHC participant should sign it, especially if they're designating somebody to represent them. Now, ahead of the grievance review, there are going to be some notices. So just to get a sense, the grievance review has to be held within 30 days of the request for a grievance. That time frame can be extended at the participant's request up to an additional 14 days. So the outermost time it should take for a grievance decision is 44 days. But during that time, usually during the first 30 days, there should be some notices that participants should be looking out for in the mail. Again, opening the mail and checking it, keeping the envelopes is important here. The first notice should be an acknowledgement letter. And this really provides a general overview of the process, but critically, it includes instructions on how to request documents from the plan and also how to submit documents for the grievance panel to review. The second notice that has to be mailed at least 10 days in advance, and we've seen it mailed not 10 days in advance, less than 10 days. There was more frequent about a year ago, and that's mostly resolved, but you have a right to advance notice. And it's a scheduling notice. It will give the date and time of the grievance and the location if it's in person. And it may include the number the plan will use to call the participant, and it may include dial-in information for the grievance. So in our experience, one of the plans, there's 3, PA Health and Wellness, consistently provides the dial-in information in their notices so people can dial in. The plan will also attempt to call on the day of the grievance, but if there's something wrong, there's a way to call in. We aren't seeing that information with AmeriHealth, Caritas, or Keystone. They tend to call on the day of the grievance. And with UPNC, in our experience, when you get that scheduling notice, you really have to call in and confirm that you still want to attend and request the call information or request to be called in order to be able to participate in the grievance. So it's not the same with all the plans. Ideally, all of them would put some kind of call-in information into the notice so that people would know what to do in case they aren't given the call-in information in advance by phone. But right now, PA Health and Wellness appears to be the only one doing that. Okay. Now I'm going to turn it over to Pam to talk to you a little bit about, or a lot about, grievance preparation. Pam?
Hi there. Amy, can you hear me all right?
I can.
Excellent. Yes, so my name is Pam Silver. I'm also a staff attorney at Pennsylvania Health Law Project. So I guess I'm going to talk about what happens next once you have requested your grievance and started getting those notices. Next slide. Slide. Okay, so the important things to remember are the participant has several rights. They have the right to participate in their grievance by phone, in person, or by video conference. But you really need to make sure you're letting the plan know that you plan to participate, because as Amy explained, if you don't advise them that you want to participate, they can and they may hold it without you. The participant has the right to appoint a representative to represent them. So for example, they might come to PHLP or another legal aid organization, or they can designate a family member to speak for them. And the grievance request form that Amy showed you guys a sample of earlier has a space for them to make that appointment. The participant also has the right to a reasonable opportunity to present their evidence, their arguments, and witnesses. So once the participant's at the grievance, the plan cannot just like cut them off after 5 minutes. They have to give them some reasonable time. Slide. So looking at this from a big picture, what the participant is trying to show at the grievance is why the service or item is medically necessary, right? In the case of PAS, so they want to explain why they need not only why they need the PAS, but why they need the amount of PAS that's being requested. So for example, if they're facing a reduction, they want to explain any reasons why the hours being proposed by the MCO are simply not enough, or why the any additional hours they're requesting are medically necessary. And you know, if there's been no change in their condition, they should make that clear why they still need the amount of hours that they've been getting. And they want to focus on how providing that amount of PAS meets the definition of medical necessity. It doesn't have to be medical, the service or item doesn't have to be medical in nature, but it needs to meet this definition. So if you'll flip to the next slide, we can look at the definition of medical necessity. So there's 4 different parts to the medical necessity definition, and a service is considered medically necessary if it meets any one of those definitions. So the first 3 prongs are what you typically think of when you're thinking of medically necessary, something that prevents an illness, condition, or disability, or reduces or ameliorates the effect of it, or helps the participant to achieve or maintain maximum functional capacity. You know, if my hours are reduced, I'm going to backslide, my condition is going to backslide, or I'm at risk of X, Y, and Z. But the 4th prong is the most interesting one. It includes services that will provide the opportunity for a participant receiving LTSS to have access to the benefits of community living, achieve person-centered goals, or live and work in the setting of his or her choice. So it can be helpful to talk about any ways that the participant might be at risk of having to go into a nursing home if their hours are changed. Next slide. So preparing for the grievance is very important. The more you prepare, the more you'll get out of a grievance. And there's a few different things you want to do ahead of the grievance. Slide. So the first thing you want to do is gather evidence from the CHC plan. The participant has the right to review before the grievance all relevant documentation pertaining to the subject of the grievance. This is part of the CHC agreement between the state and the MCOs. And if you look back at the grievance request form, there's a box to check that you want to receive these documents. But we also recommend asking for the documents if you're requesting a grievance by phone, we also request that you ask for the documents at that time. So some of the documents that are valuable to see might be the comprehensive needs assessment. It's also called an inter-RAI. If Amy wants to type that into the chat so people could see the spelling of that. That's the assessment that the plan is relying on to decide how many hours are necessary. You want to be able to see that assessment so you can go through it and if it has any inaccurate information about the participant's needs, you want to be able to highlight that in the grievance. For example, if it says a participant is completely independent with toileting, when in fact they need significant help with that, or if it says the participant is independent with eating, when in fact they need supervision so they don't choke, you want to be able to highlight those kind of and clarify those kind of mistakes so that the plan can change their decision. Another document you might want to see is the person-centered service plan. This is the finished plan that highlights all the participants' needs and the services that the MCO is putting in place to meet those. It can be helpful to see this because it might have inaccurate information about, let's say, it's saying that the person has informal supports that can help provide some care, and that's not the case. The service plan might say something about that. Another document we often look at from the plan is what's called a UPMC calls it a time for task tool. AmeriHealth calls it a PSST, or a personal services supports tool. This is, it's really an algorithm that takes the responses given by the participant about their ADL needs, their needs for assistance with activities of daily living, and spits out a suggested amount of time needed for each task. And then the service coordinator reviews that and can provide notes and additional suggestions if additional time is needed. And then the person reviewing this on the back end at the MCO will look at that and see if they agree that the amount of time suggested needs to be adjusted to properly meet the participant's needs. Another document that's included in this is you might get some actual notes from the service coordinator or the CHC plan when they reviewed it, like the notes from the physician who reviewed the records. Those can be very illuminating in understanding the reasons for the denial. So we also suggest asking any other documents that the plan may have. Now, participants can request the documents, again, by checking the box on the grievance request form. The denial notice should have instructions on how to request these documents, and they can request them over the phone. We strongly recommend following up with the plan every few days until you actually get these documents, because in our experience, it often takes follow-up in order for the plans to actually produce these. But if you can get them, they can be very helpful in preparing for the grievance. May I have the next slide?
Yeah, just a quick note on that. So if you don't get the documents, you need to follow up. And if you wind up at the grievance and you still haven't gotten the documents that you requested, you should make that very clear on the record. It's kind of rough because there's not, we as attorneys, if that happens to us, we fight tooth and nail and, make complaints to the state. But it's just important to note that and make sure that that's clear, and you can file a complaint about that as well. I mean, it's not a perfect solution, but we have seen problems, particularly more recently with one of the plans, where it's just people aren't getting the documents until even after the grievance. And there was also a question about whether there's a time frame to be able to provide them. And the answer is it has to be sufficiently in advance of the grievance. And so we would say that, the day before is not sufficiently in advance. The morning of is certainly not. After the grievance is taking place is obviously way too late. We try to get them several days in advance so you have time to review them and be able to see whether or not there are issues in them. And that is actually that's the purpose for you being able to look at them so you can understand the decision. Thanks, Pam.
Yes. And I just want to clarify that these are documents, you're going to try and request those documents as soon as you request the grievance, really, to get the ball rolling, so you have plenty of time to follow up. So you requested the documents from the plan. While you're waiting for those, you also want to be gathering any evidence from your side that you want to be presenting as well. So any additional documents you can share that speak to the participant's need for, oftentimes it's PAS, but it could be a home modification. The most common type of document we'll try and present is a letter of medical necessity from the doctor. And that doesn't simply state, like in 2 sentences, oh, in my opinion, the participant needs X amount of hours of PAS. In order for the letter to be most useful, it should really expand and provide details as to why the participant needs that service or item, why it's medically necessary, and all of the ways it meets that medical necessity definition. I think one of the most important things that we do in preparing for agreements is potentially following up with doctors to get a strong letter of medical necessity that really provides all the reasoning. Other types of medical support you might want to gather might be medical records or occupational or physical therapy records that speak to the person's functional needs. Because remember, you're not just looking for diagnoses, you're looking for the person's level of functioning and any documents that talk about that. It can also be helpful to have any records that speak to any safety concerns. So if the participant is a fall risk, or if they have dementia and they have a history of wandering, maybe a history of seizures, or any other need for safety supervision, any records that you can think of that would speak to that can be helpful. That could be an ER report for that time they fell. Or, for example, if they wandered and were found by the police, that police report that describes them being found wandering down a busy street could be helpful for showing the safety risk. And you can think creatively about what kind of medical providers that can speak to the person's needs, but the important thing is you want to start gathering these as soon as you file a grievance so that you get them in time. Slide. Another particularly helpful type of evidence that you can provide might be a log or a journal illustrating how the current PAS hours are being used. So, for example, you can track on good days and on bad how you, if you're the caregiver, how you are spending all your time. Like you spent, 8 a.m. you arrived and you got the participant out of bed. 8:15 to 8:45, you helped them, get shower and get changed. At 8:45, you brought them in the living room and started making breakfast. That kind of a journal, diary, chart, however you want to present it, that shows how you're using your time can be helpful for giving the grievance panel a picture of exactly how they're using that time. And it can be helpful for showing, for example, any sort of safety risks or any time that you're providing supervision. And it demonstrates the amount of time. So if the plan is recommending, for example, only 20 minutes a day for bathing, and the participant really needs a lot more time than that because they're shaky or they've got cognitive issues that require it to take more time, or their conditions deteriorated, it can be helpful to point to, well, look, 3 days, like every day this week, it's taken me at least 45 minutes to get them out of the shower. So if as a direct care worker, if you prepare a log like this or a journal over, like, say, a 2-week period, that can sometimes be helpful. Another thing to keep in mind as you're preparing for a grievance is that where there's family caregivers in the picture who are paid, especially if they're living with the participant, be prepared that the CHC plan is going to view those cases with more skepticism. There's a very strong, in our experience, there's very strong views within these plans that if there's family caregivers in the picture, they should be providing at least some unpaid care. So in a case where maybe there are family members living with the participant who aren't available to provide care because they're working or they have their own health problems, it can be useful to provide documentation explaining why they're not available to provide additional care, to rebut that kind of assumption that family members should be providing unpaid care. Slide. So as you're gathering your own evidence and trying to get documents from the plan, you also want to think about who might be good to act as, for lack of a better term, witnesses at the hearing and help speak to their needs. So this might be the CHC participant themselves, right? It might be their caregivers, or like paid or unpaid caregivers who are familiar with their care. It might be friends or family or neighbors or doctors or other providers. It can really be anyone who is able to speak to their need for the service or item. It could also, you could also try and incorporate the service coordinator who did the assessment, but in our experience, a lot of them won't testify, won't participate, or they're not able to participate. And because, it puts them in a difficult position with the plan. I will say that out of respect for the Greens panel's time, I wouldn't present more than 2 or 3 witnesses at the most. Amy, do you have anything to add here?
Nope.
Okay. All right, next slide. So this is sort of a half step, and it could be done really at any point. I would say whenever you get this scheduling notice is the time you want to contact the plan and confirm that you're planning to participate and how you plan to participate. Even if you already checked the box on the grievance request form, right? Even if you spoke to them like on the phone when you requested the grievance, said I'm going to participate, you want to call and confirm that once you get the date and time of the grievance. Like Amy said earlier, if the participant does not notify the CHC plan, they may hold the grievance without them. This is I think in our experience, UPMC is the biggest culprit here, only because they don't necessarily explain in their notice how they're going to contact the participant for the grievance or provide a dial-in number. So you whichever plan you're working with, really, you want to call them, double check whether the plan is going to call you or you need to call them, and ask for dial-in information for the grievance if it's not already in the scheduling notice. If it's a video grievance, get the link and the login information. When you're calling to confirm, this is also a good chance to follow up on the document request if needed. Right? If you still haven't received the documents, explain that to them, and potentially you may want to ask to reschedule the grievance, actually, if you want more time to get those the documents from the plan. When you're calling to confirm with the plan, this is also a good chance to confirm where they want you to send their documents. The grievance scheduling notice should have contact information where you can mail or fax your own documents for the grievance. But when you call them to double check and confirm your participation, you can also ask them, like, if there's an email or a fax number to send the documents. Next. And then before the grievance meeting, the last step is really to submit the documents that you want them to see. So I would, before the grievance meeting date, send that grievance department a list of the names and the phone numbers of the witnesses who are going to, of anyone who's going to be participating, and a kind of a cover sheet with a list of any documents you're submitting. And you should submit any of the medical records, doctor letters, charts that you've gathered on your own, as well as a copy of any CHC plans documents that you want to discuss. For example, if you got the assessment and there's all kinds of mistakes in it that you want to bring to their attention, submit a copy of that with the rest of your documents. Don't assume that the grievance panel is going to have that right in front of them. And that's, yeah. Oh, I just go back for a second. And again, where you're going to submit this, you're going to submit this to the address or fax number that's provided in the scheduling letter, or whatever fax or email you received when you contact the plan to confirm your participation. Next slide. All right, so at the grievance meeting, right, either the plan will call you or you'll dial in using the dial information that you obtained from them. There should be a grievance coordinator plus 3 voting members of the grievance committee. This will include a medical director or a doctor. They're really the ultimate decider of this, but it'll also include an employee of the plan and a non-employee voter. So there should be 3 voting members of the committee present. Excuse me. In addition to the grievance coordinator who's there to facilitate. So once everybody's on the line, the grievance coordinator will have everyone introduce themselves. They may provide a brief summary of what the issue is so that they can confirm that everyone's on the same page. And then they'll turn it over to the participant or their representative. When it's the participant's time to go, you should, introduce everyone from your side, confirm that the grievance committee has received all the documents that you sent. Don't assume that they received them, double check. And then you'll want to take the time to just explain why the service or item in question is medically necessary using the witnesses and the documents that you obtained. You want to go through the medical necessity and also talk about any consequences if they don't authorize the service or the item. The CHC plan may ask questions. For example, the medical director may have follow-up questions. In our experience, these are usually like this isn't like in a court proceeding where they're trying to trip anybody up. Usually it's just clarifying questions about the participant's needs. They may have clarifying questions about what other services or resources the participant has available. The important thing is that they may have questions and the participant should be prepared for that. The grievances usually last anywhere from 15 to 45 minutes, maybe longer. So participants should be mindful of that as they're planning, right? You don't want to plan a 2 or 3 hour presentation. You want to really try and keep the presentation to 15 to 45 minutes at the most. But also be prepared to politely push back if it's been like 15 minutes and the plan is starting to like play you off the stage. Feel like be prepared to politely push back and explain, I need a little more time to finish explaining. The grievances are recorded or transcribed, and usually the grievance facilitator will explain that at the beginning of the meeting, and the participant will have a chance to consent to that recording.
Before we go on to the next slide, I just wanted to flag a couple things regarding the grievance meeting and doing it in person. Mm-hmm. So I think people are usually pretty disappointed when they do an in-person grievance. That you have an absolute right in Pennsylvania to do one. So I would definitely go forward with that if that's what you want. But to understand what's going to happen, it's not that everybody has to be in person. So the requirement for an in-person grievance is that one member of the panel, and it may not be the doctor, is in person, and the other 2 have to be there at wherever the location is by video. So, there are sometimes very good reasons why you want to have the doctor or somebody to be able to see the participant or see you if you're the participant. But just know that it doesn't mean that you're going to meet the entire panel. So sometimes in terms of convenience, if you can do a video grievance from your home, that might make more sense, but it's really up to you. You have that right. But people's expectations are that everyone's going to be there, and that's just not the case. Although one person does have to be there, and they have to be one of the voting members of the grievance committee. We've had grievances where nobody showed up. So it's at least critical that one person be there. The other thing is, in terms of the length of time, the length of time does need to vary to accommodate people with disabilities or limited English proficiency, people who need translation. So if somebody needs an interpreter, whether it's a sign interpreter or like a Spanish interpreter, that should be requested in advance so they're prepared, and there should be an expectation that it's going to take longer. So there it's even less appropriate to rush a participant. The same is true if somebody needs a reasonable accommodation. There was a question about this in the chat. I would suggest asking in advance just so that they can put aside more time for a reasonable accommodation for additional time in order to be able to present, as is the right, the arguments for why the services are necessary.
All right. So just to get a sense of the timing, so for a regular standard grievance, the plan is required to issue a decision within 30 calendar days of the grievance request. That can be pushed back an extra 14 days if the participant asks for more time. So for example, if the plan schedules it for a day that just doesn't work for the participant, they can ask to reschedule it and push it back a little bit if they need more time. But it should be at the participant's request. Otherwise, you're looking at 30 calendar days. And then once the grievance is completed, the plans should mail out the decision within 5 business days of the grievance committee meeting and send a copy to the representative. So if you had your grievance and it's been, let's say, a week and you haven't heard anything, might be a good idea to follow up with the plan just to see if they've issued a decision. There is an option to do an expedited grievance if the provider certifies that waiting this normal 30-day time frame would jeopardize the participant's life or health. And so if you get if you request an expedited grievance, there should be a decision within 48 hours of preventative certification, that provider certification, or within 72 hours of when you first initially request the expedited grievance, whichever one comes sooner. Next slide. All right, so if you win the grievance, you'll get a notice saying that the denial has been overturned and the plan is reversing its decision. If you win your grievance, the plan has to provide the full hours that were authorized at that grievance. They can't appeal the decision of their own grievance committee. So if you win your grievance, you're good. If for whatever reason, let's say the participant had lost their continuing benefits, or if they were requesting an increase and they won it at the grievance, if the CHC plan does not get those hours into place promptly, contact us or follow up with the plan. What we've seen in some cases is there's a case every once in a while we'll have a case where for whatever reason the grievance decision wasn't communicated to the authorizations department, or there was a mix-up where the agency can't see the updated authorization reflecting the grievance decision. So sometimes we have participants who need help ironing that out. So I would contact the plan or feel free to contact PHLP and we can help intervene with the plan to make sure that the hours that were won at the grievance are implemented. On the other hand, if you lose the grievance, if the denial is upheld, there are additional levels of appeal that you can pursue. Amy, oh, there we go. So, and you can pursue them simultaneously. One is the fair hearing, which you have to request within 10 days of the grievance decision if you want to keep KS hours during the appeal. And you're going to request that by mailing in mailing in the form to OLTL. Amy, do you have the next slide? That's the slide I was looking for. So you can pursue two different types of appeals simultaneously. One is the state fair hearing. One is the external review. For the state fair hearing, you have 120 days total to request it. But if you want to keep the current benefits in place while you're waiting for the fair hearing, you have to do it within 10 days. For the external review, you have 15 days to request it. But as with the state fair hearing, if you want to keep in place the current hours while you're waiting for an external review decision, you have to request that within 10 days. A common pitfall we see participants fall into is, okay, they request external review, but not a fair hearing within 10 days. The problem with that is, okay, if you request a timely external review, you've locked in aid paid pending while you're waiting for the external review decision. But the right to aid paid pending, unless you request the fair hearing also within 10 days, the right to aid paid pending ends when you get the external review decision. You still have time, you might still have time to request the fair hearing, but you've lost the right to aid paid pending. So one thing we would just recommend, do not wait until after the external review decision to request a fair hearing. If you want to pursue both appeals, file them both within 10 days of the grievance decision. And I think the upcoming slides are going to go into more detail about how to request each of these. The other common pitfall we see is sending the wrong appeal to the wrong place. For external review, you can request that by simply calling the plan, your CHC plan, and saying, hey, I got this grievance decision and I want to request external review. That's all you have to do. For the fair hearing, you must submit the fair hearing request by mail. There is a form that comes with the grievance decision that you can use, but you need to request it by mail, and that goes to OLTL. One thing we've seen is that participants get confused and they mail that fair hearing request to the CHC plan, and so it doesn't get processed properly. Or participants call to request external review and they ask for fair hearing at the same time, but they never send in that written fair hearing request. You have to submit the fair hearing request in writing eventually. And so the next few slides are going to go into more detail about each of these different types of appeals. Next slide. All right, so a fair hearing is a proceeding with an administrative law judge. It can be by phone or in person. The advantage of having a fair hearing is that the decision maker is outside of the plan. You're no longer trying to persuade people who are employed by the plan to change their minds. You're talking to an administrative law judge who has no skin in the game here. Like I said earlier, to request a fair hearing, you have to submit the fair hearing request form postmarked within 120 days of the date on the grievance decision. And if you want to receive aid paid pending, you have to postmark it within 10 days of the grievance decision or by the effective date of the grievance decision, whichever is later. If there's no form attached, if the grievance decision doesn't happen to include that fair hearing request form, you can mail a letter to the Office of Long-Term Living, and that address should be provided in the grievance decision. but you do not mail the fair hearing request form to the CHC plan. Again, this is a common mistake that people make. Make sure that you're mailing the fair hearing request to the correct address. If you want an in-person fair hearing, you should specify that on the fair hearing request form or in your letter. Otherwise, they're going to schedule it by phone. When you mail in the fair hearing request, we strongly recommend that you make a copy of that request for your records and that you send it certified so that you have a receipt of when you sent it. So that if for whatever reason, let's say the plan doesn't get notice in time and they go ahead and reduce your hours or like take away the continuing benefits, you have proof of when you sent it, so you can show, no, I filed my fair hearing request within that 10-day window. I'm entitled to aid paid pending, turn it back on. Next slide. So the fair hearing is supposed to be scheduled and a decision issued within 90 days from the request for a grievance. So we're not talking about from the time you request a fair hearing. This is the clock starts, the 90-day clock for a fair hearing starts when you actually request your grievance. You don't count the time between the grievance decision and the fair hearing request. You also don't count any delays requested by the participant. So if you get a fair hearing date and ask to reschedule it, that's not going to push you past the 90 days. In our experience, it's frequently taking longer than 90 days to get a fair hearing date, which if the person's getting continuing benefits isn't a problem necessarily. But if it's a case where either the participant was seeking an increase or they lost aid paid pending and their hours have been reduced while they're waiting for the appeal, it can be a problem if this drags on. For that reason, there's a right called the right to interim assistance. And so if the hearing is not scheduled within this 90-day window, the participant has the right to receive those disputed services. So to get the services they're requesting temporarily while they wait for the appeal. And they can contact a PA Health or PHLP, we can help them with this. So keep in mind, if a person doesn't have continuing benefits or they were seeking an increase, there may be a way to get some relief while they're waiting for this fair hearing if it's really dragging on.
And the reason Pam mentioned contacting us is you can contact the plan. They're required to put it in place until the fair hearing decision is issued. It's not entirely clear that most people or anybody but a handful of people at the plans know about interim assistance. So you really probably have to call the grievance department. And that's why Pam said you might have to contact us for, I need help getting interim assistance.
Right.
Okay, so I'm going to talk a little bit about external review and just how to request that. So external review is done by an outside agency. And so this is, as Pam mentioned, this is like happening at the same time as the fair hearing. If this is regarding a reduction, because you want to request both at the same time to keep the benefits going throughout the entire appeals process. But external review, it's another level of review where you have somebody who's independent looking at the decision that the plan made. It's reviewing the plan's grievance decision, but the plan is supposed to send over the file related to the original decision as well. So it's a doctor, an independent doctor. There are a bunch of different organizations that Pennsylvania contracts to do these reviews. They're of varying quality. We have very mixed success here, but we've tended to request them in most situations. We haven't given up on this process. So it's something that we would recommend. The external reviewer, things have been a little strange with this process during COVID. I'm not going to get into the details of why, but at least starting July 1st, the external reviewer is going to be assigned by the Bureau of Managed Care, which is a part of the Pennsylvania Department of Insurance. When I said say here that it could be assigned by the CHC plan, that is what's been happening during COVID to a greater or lesser extent. It's not been that successful. So hopefully on July 1st, the Bureau of Managed Care will start deciding who's going to do the reviews. It is an independent physician and it's a paper review. So this is not like the grievance or not like a fair hearing. There's nobody you can talk to about it. The reviewer considers the grievance file that's sent from the plan plus anything else that the participant sends in. So to request external review, again, you have to request within 10 days. That could be 15 during COVID, so check the dates. It should be 15, but it's within 10 days of the mail date on the grievance decision to keep the benefits going. But otherwise, it's actually a very short period of time anyway. There's only 15 days to make the request at all. So during COVID, it's really 15 regardless. And it's requested by contacting the plan by phone or writing a letter in most situations. PA Health and Wellness, actually, if you look on their grievance decision, they allow email and fax external review requests. So if the request is made by phone, the way we've recommended earlier, write down the date and time of the call and request a call reference number. If you make a request in writing, do that by certified mail so you can prove that it was actually sent. So the timing of this is a little different. So once the plan gets the request, it's supposed to send it to the Bureau of Managed Care to assign, but the plan is supposed to issue an acknowledgement letter. And then they're also supposed to send a letter to the participant telling them the name and contact information for the external reviewer and telling the person that they have 15 days from the date on that letter to send additional documents to the external reviewer. And it's really critical that people receive this information because if you don't know who the external reviewer is or what your time frame is, you have no idea how to get the documents to the reviewer. So maybe you had your grievance and you were waiting on some medical records and you just weren't able to get them in time for the grievance, but you want to submit them to the external reviewer, or you want to submit some statements from caregivers, participant statements about the need for services, or there's a letter of medical necessity that you got from a second doctor that came in too late. So you want to be able to submit documents. That's the whole point. We do see these occasionally get an external review decision where the participant submitted nothing and it'll be overturned, but it's really helpful to submit additional documents. So there are a lot of issues with the timing, and this has mostly happened since COVID, and it's honestly been a disaster with trying to get external review processed. So we've seen CHC plans that don't process the request at all until you poke them and ask for it. We've seen CHC plans that don't tell the participant who the external reviewer is or provide the contact information. So the person will request external review, they'll get an acknowledgement, and the next thing they know, there's been a decision, but they had no information about who was being assigned. So the solution, and this is what we have to do too, is to follow up with the CHC plan every few days to confirm the status of the request and get the external review contact information. It is not an ideal situation. The hope is that the Bureau of Managed Care will take over and take back not only the decisions about who the external reviewer will be, but sending out the notices. But for the time being, unfortunately, participants and advocates have to do a lot of work to make sure the process goes as it's supposed to go. Now, the certified review entity is supposed to issue its decision within 60 days of the request. This is usually earlier than a fair hearing will be scheduled, but sometimes we see that a fair hearing is scheduled and an external review is still outstanding. And in those situations, you can often request what's called a continuance or a postponement of the fair hearing in order to wait for the external review decision. The managed care plans are usually fine with this, because if they win the external review, they're going to point to it and say, another doctor said that the person doesn't need these services. There are ways of arguing that that's not necessarily the case, especially if they didn't get the documents you sent in. So usually the plans are okay with it, and sometimes the fair hearing office is also okay with it. So that's an option. Pam, did you have anything else to say about external review or fair hearings?
I do not. I just wanted to add that, like, in practice, we will often, we got a question about if the external review and state fair hearing reach different conclusions. Each decision, either decision would be binding on the plan. So if the external reviewer says, like, overturns the grievance decision, that's going to be binding on the plan, even if the administrative law judge at the fair hearing says something different, and vice versa. But in practice, like Amy explained, if we're waiting on an external review decision and we get a fair hearing date, we would often try and postpone or continue that fair hearing to wait for the external review decision, specifically to avoid wasting the ALJ's time, and also to avoid having those kind of conflicting decisions. So that would just be that would be the only thing I'd have to add.
Thanks, Pam. So I put, oops, I went the wrong way. Previous. So I put up a slide here, which is a slide about resources that we have. Now, obviously you can't link on Zoom, but when you get the slides, which will be distributed after the webinar, you can go and link on these links and access our website, where we have some guides that can help prepare in even more detail for a personal assistance service denial. That's the first one linked. It actually gives some strategies. And there's also a guide on just the timeframes, because they are confusing. And we have a guide for person-centered service planning. So how to sort of prepare for a comprehensive needs assessment and person-centered service planning, as well as a guide to troubleshooting service coordination issues in CHC. So that's sort of a toolkit for people. And then finally, of course, I mean, it's really critical that you know where to go for help. As I mentioned at the beginning, we have a helpline. It's open Monday and Wednesdays, 8 to 8. It's generally, we have it set up so you have to leave a message. We do a little live answer, but there's just not enough ability to do live answer for all the calls. And we have an intake paralegal. She gathers information and passes on the case to a case handler if we're able to do that, or she'll send out materials if we're not able to assist. And our helpline info is also printed on the denial notices. So every denial notice and every grievance decision actually has our number. There's also the ability, if you want technical assistance. So this is not if for an individual case, but let's say you're an advocate or you're a provider who's having general issues with a case, or generally helping somebody, and you want technical assistance, you can also call the helpline, or you can email the helpline at staff@phlp.org. That's staff@phlp.org. So that concludes the presentation portion. I want to see, I haven't had a chance to look at the questions since I started talking again, but are there any questions that we can answer live? And there are some questions in here that are not quite related to the subject of the presentation, so we can send out answers to those later. like, because there are issues related to staffing that we've definitely seen in CHC, and that's just a much larger issue that we can talk about. And we can't answer individual questions. So Pam, are there any questions that are appropriate at this time?
There have been a couple folks asking about how they can receive a copy of these slides.
Right, so the slides will be mailed after the presentation. So we're going to send them around after the presentation concludes, along with a survey that we really do hope you complete.
And if you want a hard copy of the slides, I would suggest reaching out to that email that Amy just flagged, the staff@phlp.org, and ask them and request to have a copy of the slides mailed to your address.
Okay. So thank you all for joining us this afternoon. I hope you've learned enough to be able to sort of move through the quagmire of the appeals process, and reach out to us for assistance, technical assistance, and I wish you all the best challenging these denials.